Hi, good afternoon. Welcome to the BEADS Provider Care and Case Manager monthly webinar. We are excited to have you join us and to have these back up and running. So my name is Heather Dane, and I am the Chief Program Officer here at BEADS. And so we are excited to share some information with you today. So before we get started, just wanted to go through a couple of housekeeping items. So if you are an individual who would like to use live captions, you may do so by turning on live captions and subtitles and selecting the captions/subtitles on in your video controls. And then to change the caption language, select settings, caption subtitles again, and choose the language that you would like. If you have a question, we welcome all of those questions. You can put those in the Q&A on the right side of your screen. So you would just click that Q&A box. You would type your question in the box and then select send. And just for your information and as a reminder, if you've been on these before, your question is only visible to the presenters. So we do have a special guest with us today, which we will allow a little time for questions with him at the end of his presentation. But with the rest of the information that we'll be providing, if we have time at the end, we can answer any other questions as time permits related to some of the other information that we'll be sharing today. So just a kind of brief overview of what we're going to cover today. So we are excited to have Ben with Night Owl Support Systems with us. He is going to talk about his IPP project and share information about that that might be of interest to those of you. And then we are going to do some general kind of provider updates that is true across all waivers. So whether you are a provider or a case or care manager with health and wellness, TBI, FSW, or CIH, we have some updates that's relevant to all of you. And then we will also have provider updates specifically for the health and wellness and TBI waivers. And then we will also have updates specific to the CIH and FSW. So as always, we invite you to give us ideas for future webinar topics. And so please feel free as you think of those to enter those in the Q&A as well, because those help us to ensure that the time that you are spending with us during these monthly webinars are meaningful to you and provide you the information that you are hoping to get through these. So with that, we have an Innovation Pilot Project special presentation. So our guest speaker is Ben, and Ben is the Director of Special Projects for Night Owl Support Systems, and will be introducing us to Night Owl's Innovation Pilot Project. So as I just previously mentioned, there will be about 5 minutes for Q&A following the presentation. And you can add any of those into the Q&A. So with that, I am going to hand it over to Ben.
Thank you very much, Heather. It's great to be with you all. Thank you for having me. As Heather said, my name is Ben Richter. I'm the Director of Special Projects with Night Owl Support Systems. And we were invited today just to talk about some of the Innovation Pilot Project activities that we've been doing. And without further ado, let's just get right into it. So we had 2 projects that were approved. The first one is colloquially referred to as ERST, the Enhancing Remote Support Technology Project. And if you go to the next slide, I'll talk a little bit about the overview. So what we were trying to do with this project is expand the service capacity of remote supports. Basically, we wanted to see technology is always changing. We wanted to see if adding new technology two remote supports offerings in Indiana would expand our ability to address a greater breadth of need among Hoosiers with disabilities. So are there people who are currently left out of being able to benefit from remote supports that could be successfully served by the service if we had different and new technology? We also wanted to see what technology was desired, like what individuals actually wanted to have as part of their remote supports. And so that was part of what we did with our initial IPP Tech Wishlist survey that was promulgated by the state. And I believe in our, that was earlier this year, I believe. So we got some great feedback about technology that people are looking to use, what they think would help them, which is obviously a huge component of any effort to add more technology to remote supports. And then a couple of our outcome measures is we're going to like accumulate information from our own internal research and development that will, give us an idea of how this technology can be integrated into remote supports services, what sort of integration is necessary for it to be a cohesive service that actually does help people. And then we also have follow-up surveys at the end with the device technology users. So we have actual folks on the waiver who are testing this equipment, and they're going to provide feedback as to whether, this helped them address a need that wasn't otherwise addressed with remote supports, if this allowed them to access, a new level of independence. Next slide, please. And so the sort of timeline of what we've been doing, sort of an outline of our activities, is we first had to look at the devices that people wanted and what was available, and sort of on a preliminary basis evaluate the efficacy of these devices. Then we went through an extensive process of testing the devices internally and externally. We wanted to make sure that everything was rigorously tested. Obviously, before we put it in the hands of individuals with disabilities, we just have a very high threshold of reliability that these new technologies have to meet. And then we want to implement them in actual homes with actual people to see if they would benefit them. That's sort of the phase that we're in now. And then, like I said before, we'll be gathering feedback from the people who have been using it to evaluate the impact that those new pieces of technology have had on the lives of those folks who are using it. Next slide. Thank you. And this is just a survey of the different types of devices that we've been testing and adding. So the first one, I'll just go through them really briefly. The first one is a NOS Connect app, which is an app that it will accompany a tablet. And a tablet was one of the most requested items that we had on our tech wish list survey. So we found that a lot of folks wanted access to a tablet. And so as part of this, we have the NOS Connect app, which allows individuals to speak face-to-face with a remote support professional at Night Owl. And we found that this is really beneficial. It helps, establish the relationship. I mean, I don't think much needs to be said about the value of speaking with someone face to face as opposed to just, audio only. But we've also found that for some folks, a quote unquote disembodied voice coming from something like a speaker may exacerbate or not work well with certain mental health conditions. So we found that having it anchored to a person who's speaking, it's all very beneficial to folks. And then we have Angel Sense, which some of you may be aware of. This is a device that's been around for a while. It's its own. They're a third party, and it's basically a mobile PERS unit and geo tracking, like geolocation device. But what we've done is we've integrated it with our remote supports so that when an individual out in the community presses a button, they're able to get in contact with a remote support professional. So that person has access to their protocols, to information about their lives. It's someone who's within the system of remote supports, who knows more about them than, say, a random person fielding a call. And then on the bottom left, we have a Qualsys panel. And this was a sort of an unexpected development, but it turns out when you try to implement new technology, because things are always changing, you're working with different manufacturers and whatnot, you have situations where more foundational pieces of equipment need to be updated so that new technology can be added. So that's all part of the discoveries that we made as we went through this process. And then the one in the middle on the bottom is a Nortec device. It's also an MPERS. And so part of what we're doing is we want to make sure that the solutions that we bring in this project are cost effective for folks. So we're sort of doing a comparative look at which of those, the AngelSense or the Nortec device, is more cost effective for folks once the grant period ends. And then the very last one is the Boundary Care Watch. And this was another highly requested item on our IPP Tech wish list, which was biometrics. So a lot of folks wanted to be able to look at heart rate, oxygen saturation levels, those types of things. And so the Boundary Care Watch allows us to integrate that information into the real-time care that's provided by remote support professionals. So we're really excited about all these developments. We're hoping to get them into more people's homes in the near future. And then the outcome of this whole project will be a comprehensive report that talks about what we found along the way, what impact we were able to make with these new devices. So it's really exciting stuff. But we have another project as well. We could go to the next slide, which is COURSE. This is another acronym. I know we love our acronyms, which stands for the Center for Remote Supports Education in Indiana. So you'll sometimes see it styled CRSE.in. And it's a remote supports e-learning curriculum. So if you go to the next slide. Thank you. So what we set out to do with COURSE, and this is one that I'm especially excited about, we set out to create a provider-agnostic, Indiana-specific remote supports education, curriculum for stakeholders in Indiana. So what we found is that a lot of the time when folks are getting told about remote supports, it's through the vehicle of like a sales pitch. You're talking to a specific provider, they're talking about their specific services, or it's the state, and the state's done great education efforts, but we felt that with our experience as a subject matter expert in remote supports, that we could lend the remote support vendor or provider's view to sort of create a comprehensive curriculum that tells you what you need to know about remote supports. And another reason why we wanted to create this is because we understand that a lot of organizations have turnover. That's just how it is. So whether you have a direct support professional or a case manager that's coming in, that's new to the industry, that doesn't have the institutional knowledge that you have, remote supports has been around in Indiana for quite a while, but, new people are coming into the industry every day. So we wanted to create sort of a centralized way that folks could go and access information, and whether it's a refresher or whether it's I'm learning about this for the very first time, they could learn the fundamentals, they could see success stories. And then we also wanted to make sure that we included implementation guidance. So it's not just an information dump, it is also practical steps that you can take to begin looking at folks you serve to see whether remote supports would be beneficial to them. If we go to the next slide really quick. And so another part, we're aware as a remote support provider, we have to go through a lot of trainings. Our staff have to go through a lot of trainings. Trainings are everywhere. The last thing a lot of people want is another one. So what we tried to do is make it very compact, very lightweight. There are modules you can go in, you can do 15 minutes and get through one lesson and be done. You can, go to it when you have free time. We really tried to make it something that was like asynchronous, very approachable for professionals who are busy. The other thing we wanted to do is add sort of what I was talking about, the implementation guidance, the practical procedures. So when you take COURSE, what you walk away with are practical action steps that you can take. So that's, surveying the people you support to see if remote supports would benefit them. That's talking to the team. Maybe you have a person that you think, man, they would really, really benefit from remote supports, but their family just isn't on board. Well, we have some information about how to talk to them about it. So it's a lot of the practical obstacles that we face when we try to integrate remote supports into someone's services. There's information about how to address those. And then lastly, we also have a website. It's www.course.org, and there will be a link to that at the end. So don't feel like you have to write that down right now. But that is a public-facing website that has success stories. It has lots of the basic fundamental information about remote supports in Indiana. And so what we wanted to do is create something that was also accessible to people who didn't want to go through a whole course. We know a lot of family members might be busy or might not be used to the sort of professionalized nature of, enrolling in a course, starting your learning modules, that sort of thing. So we wanted to make something that was accessible to family members, self-advocates, individuals as well. Next slide, please. And so, like I said, the purpose was to educate the stakeholders about the benefits of remote supports, and also the sort of practical purpose from an industry standpoint is that turnover that I talked about. There's always new people coming in who don't know about remote supports or what it does for folks. And we want to make sure that as people leave and get jobs elsewhere, maybe I was a case manager, I moved to something else, someone else gets hired as a case manager or at a provider organization, people can continue to have this knowledge about remote supports. And then ultimately, we want to increase remote supports utilization. I don't think anyone here would say that we've reached the total amount of folks who could potentially benefit from this service. I think there's still folks on the CIH and family services waiver, family supports waiver, who could benefit from those. And then this is just a quick look. It's very similar to what you see in like a Relias or a different training platform. It is housed in a place called SkyPrep, which is just a learning management system. So it's all web accessible. You can do it from your phone. You can do it from a desktop, a laptop, whatever. This is just a quick look at some of the modules that you'll see. And then if you go to the next one, it'll show you a look just inside. So if you're in the industry, you're taking trainings, you're familiar with what this looks like. But we do have, the next slide is a quick video if we have time, and I'm sure Heather will let me know, where we wanted to show one of the videos that we developed as part of this project, because we wanted to highlight situations where remote supports was really beneficial to folks. And this is an example that I personally like a lot, because it shows that sometimes it is the people you don't think would benefit from remote supports who get the most out of it. So whenever you're ready, Heather. Oh, I'm not hearing it. Are other folks hearing it?
Yeah, I don't believe the sound is working.
Okay. Unfortunate. Is there a way we can put that in the link in the chat so that folks can access it on their own time if they would like to?
Okay, yes, I apologize, not sure why the sound isn't working. So
every
yes.
time you try to use sound on a video like this through a virtual presentation, it's troublesome, we've found.
We will put the link as an announcement for everyone to be able to get to. Okay.
Okay, perfect. So it's a great story. If you do have time, I would recommend you watch it. It talks about this individual, John, who was high behavioral needs and was perceived for a long time as someone who needed, 2 or 3 staff with him at all times. And what the end of the story is that it turned out that by removing staff, his behaviors went down because most of his behaviors had to do with him not wanting staff around him all of the time. But I will say that one thing about course is that it is 100% totally free. So anyone can enroll in this, any provider, any direct support professional, any case manager, anyone in the industry, self-advocates can enroll, family members can enroll. Anyone who wants to enroll can just go to the website listed here. That's www.course.org. And in the top right, there's a button that says enroll. And then you just click that, you self-enroll, you answer a few questions, and you're in it. And it is, again, 100% free through the end of the ARPA grant period, which I believe ends in March of 2025. So you've got some time, but it's got great information. I think the average time to complete for most folks has been about like 2.5 to 3 hours of total time, and that's with the videos and everything. So it's certainly not an 8-hour intensive, but it does give you the fundamentals. It gives you those practical procedures, and we would really, really like folks to check it out if they feel like it would be something that would benefit them. And I think that's all I have for y'all. If you guys have any questions, I'm happy to answer them.
All right, thank you, Ben, so much. It doesn't look like we have had any questions, but did want to let everyone know. So in the announcements, we put several links in there for you. So one link in there is for you to learn more about NIDAL's project and the other IPPs. There is also the direct link to the course webpage that he shared, as well as the video where the sound was not working, and I apologize. And so, and lastly, there are the emails that was shared on the slide for you to be able to email with any questions or comments. And so I would just say for any additional IPP project updates, please make sure you are visiting the IPP website. There's information updated there as it becomes available. And then you can also follow BEADS on Facebook. We have highlighted a number of our IPP project grantees there and have shared some pretty cool projects there. Also, please make sure you are subscribed to the DDRS updates. You'll not only learn more about IPP projects, but any kind of announcements that are related to DDRS and BEADS. And then you may also always email beadshelp@fssa.in.gov with any questions or thoughts. So, it does look like there may be one question, Ben, I'm sorry. Oh, no, that's not a remote support question. So we will answer that one in after we get through the rest of the slides. All right. Well, thank you, Ben, so much. We appreciate you spending time with us today and sharing your project.
Yep. Thank you so much for having me. I appreciate it. And I will, hopefully you'll hear from me soon.
All right. Thank you. Okay, so for the remainder of our time, we're just going to provide some general updates as we typically do. So the next couple of slides are updates that are relevant to all providers. So whether you are a provider, care manager, case manager, or manager for the FSW, CIH, TBI, or health and wellness, these next couple slides do pertain to you. So wanted to talk a minute about individuals' rights. And so wanted to kind of make sure everyone was aware that it is the policy of the Bureau of Disability Services that an individual's rights shall not be violated. So a provider shall adopt policies and procedures that prohibit abuse, neglect, and exploitation and violation of an individual's rights. So this includes ensuring that the individual has a right to do the same things in the community as everyone else. It means they have a job if they want one. They are to be in charge of their belongings and their schedule and their visitors and how they receive services. So this is not just BEAD's policy, this is also part of federal rule. So providers should support individuals in making choices by having conversations, spending time with the individual, sharing options, helping the individual weigh their options, listen, and honor their choice. It's vital that we honor choice and rights, or we honor rights and choices that promote dignity, respect, and control. So individuals control their home, their relationships, and their services. They should decide who comes into their home, who they visit, and who they spend time with. So when supporting individuals to exercise their rights, we must also support and advocate their right to say no as well. So when providing services to an individual, consent should be granted prior to delivering services. This may also include additional written consents for staff to include things like service or support animals in the service delivery, for example. Also wanted to talk a little bit about aspiration risk plans. So aspiration is defined as accidentally inhaling food or liquids, which includes saliva, through your vocal cords into your airway, instead of swallowing through your food pipe or esophagus and into your stomach. This is a potential problem because once past the vocal cords, the food or drink enters the windpipe or trachea and can pass into the lungs. And this can turn into bacteria to enter the lungs, increasing the risk of developing pneumonia. So anyone who has difficulty swallowing is at risk of choking, has a vocal cord abnormality, coughs frequently, or has GERD should be evaluated for the need to have an aspiration risk plan. So that doesn't mean that those individuals must have one, but they should be evaluated to ensure that if a need does exist, that an aspiration risk plan is put in place. So there are several fact sheets and resources on the DDRS website that you can review around risk plans and how to develop those and how to assess the need. So now I want to talk specifically to the health and wellness and TBI providers and care managers. So an announcement went out a few weeks back and wanted to make sure that everyone was aware that there is a short video presentation that is in training that's available for health and wellness and TBI providers who are providing structured family caregiving. So please keep in mind that training was developed specifically for health and wellness and traumatic brain injury providers, so of structured family care. So structured family caregiving looks just a little different on the CIH and FSW. So this training doesn't pertain to you if you are a structured family caregiving provider on CIH or FSW. But if you are on health and wellness and TBI, please be sure to watch that video. So there is, it's a short, like 12, 13-minute video that you can find at the link here. And then there's also just the slide deck. And so those are available on the DDRS website. If you go under the quality page, you will be able to find that. So we are also looking at providing some additional guidance around structured family caregiving. So please, be on the lookout for any additional resources or materials that may become available, which would be announced through our DDRS listserv. Also just wanted to talk about incident reporting for the health and wellness and TBI waiver. So this is just a reminder that significant medical events, including changes in medical condition, are not reportable regardless of what the medical event is or where the treatment is provided. So hospital admission for pneumonia, diabetes, or high blood pressure. If the event could be indicative of abuse or neglect, then it becomes reportable under A&E. So also keep in mind that injuries of an unknown origin and significant injuries are always reportable. So hopefully that provides some clarity around what justifies submitting an incident report and what does not. So now I want to talk specifically to providers and case managers of the CIH and FSW waivers. So wanted to provide another reminder around individual service plan requirements for the FSW and CIH. So please keep in mind that authorized service plan hours for RHS/RD must be distributed across the plan year. So if an individual has residential habilitation on their plan, these hours should not be front-loaded. The planning should include looking at what are the necessary and needed hours and distributed across the plan year. If the individualized support team believes that additional hours are needed, you can follow the appropriate process to request those additional hours, and that would be through the short-term budget requests. So please keep in mind to ensure that you are distributing those hours across the plan year, because what we don't want to see is someone getting 6 months or 9 months into their plan year and then no longer having that support because all of those hours were front loaded. So we just want to make sure that people are supported in the way that they need to be supported and supported throughout their entire year. Also wanted to provide a reminder around DSP training requirements. And so we have had some questions around what are those training requirements. And so wanted to provide a reminder that per 460, a provider shall train direct care staff in management of individual specific treatments and interventions prior to working with the individual. So this includes the requirements that all providers working with an individual shall implement the behavior support plan designed by the individual's behavior support service providers. So this would mean that behavior consultants are responsible for training DSPs on that behavior support plan. So, and that should happen prior to working with the individual so that the DSP has all of the information and training necessary to provide good quality supports to that individual that is specific to them based upon their specific needs. Also wanted to provide a reminder to providers who are adding services on the CIH and FSW. So if you're a provider of those two waivers, you can get into the BEADS portal and you can request to add services to that. And so please keep in mind that when you are adding these following services to your list of offered services on the CIH or FSW, it is required that you add all service levels. So this means residential habilitation services levels 1 and 2, RHS daily levels 1 through 9, structured family caregiving levels 1 through 3, and wellness coordination tiers 1 through 3. This is because, as we all know, individuals' needs can change. And so if you are providing this service, you should be prepared to provide that service based upon what that individual's needs are at that time. So I know we covered quite a bit of information last time around budget requests, but wanted to spend some time again just going over some of this information again around short-term budget requests and long-term budget requests, and make sure that everyone is clear on what those requirements are to complete those. So again, this is only for CIH and FSW providers and case managers. So required short-term budget request submission, what is required is that regardless if it is a case manager or a provider-initiated STBR, case managers should double check all the information that's included is correct and complete before it's submitted, and that at the team meeting, once an STBR need is identified, a team meeting discussion, whether that's virtual or by phone, must occur within 45 days of the status change and prior to that STBR submission. Case managers should also ensure that there are comprehensive case notes that must be specific to each request. So please do not indicate team has agreed to ongoing STBRs, as that's not the intent. So this is the intent to provide short-term budget increases to support a current temporary need. And so there should be information in there to say what that need is and what the plan is to move forward. Additionally, at a minimum, the following must be documented. So there should be the date of the team meeting, who was in attendance, if the individual or legal guardian has consented to the request, and if any of the individualized support team member has disagreed with this request. So even just keep in mind, even if there is a disagreement, that doesn't mean it would be denied, but it is important that all of the information is documented so that everyone's input is showing there in that documentation. So please keep in mind, the case manager obtaining consent from the individual or legal guardian does not include a team discussion. So just getting that consent does not count as a team discussion. There really has to be that discussion with the entire IST. So supporting documentation that is necessary for the submission. So in the portal, there is, in the resources, there is a BP2 user guide that has more information. But so we would encourage you to go look at that. But all included documents must be current, signed, dated appropriately, and include the entire document. Please keep in mind, we all work in social services, and, the golden rule of social services is that if it's not documented, it did not happen. So really need to have all of that documentation for our reviewers and for the rest of the team to be able to refer to. So if the individual or legal guardian does not agree with the request, it will be denied. So that really is because the individual and legal guardian are the ones who drive those services. And so they must be in agreement with the request. So wanted to go over a little bit around the timeframes for the STBR submission. So please keep in mind, we all know that things happen very quickly sometimes, but if you are proactively identifying the need for an STBR, that really sets up for success and allows the STBR to be reviewed timely and have a decision. So the STBR must be submitted to the BEAD central office. So not simply submitted in the portal on or before the 45th day from the date of the status change. So teams should be proactive in discussing the need for an STBR and not waiting to submit that at the last minute. So we provided you a few examples here. So in the first one, provider submits the STBR in the portal on day 35, and the case manager does not submit the STBR to the BEAD central office until day 46. So in that instance, it's late. So if the provider submits, another example is if the provider submits an STBR in the portal on day 47, it is late. Additionally, if a CMO, case management organization, or the case manager submits an STBR in the portal on day 30, and the CM supervisor reviews on day 33, and it's submitted to BEAD central office on day 39, then it has been submitted timely and is not considered late. Provider submits, lastly, another example, provider submits the STBR in the portal on day 44. This does not provide the case manager or the case manager supervisor adequate time to review and or RFI it back to the provider if that's needed. So it will be late. So again, if an STBR is submitted to the BEAD central office after that 45 days and a reason is not provided in the comment section, it will be denied because it is past the time frame. So you can also keep in mind that all appeal rights are included with all denial notifications and letters. Wanted to provide, again, some additional information. So when an STBR is submitted late to the central office, the reason must be noted in the comment section. So as we just previously stated, so including the reason for the untimely submission does not guarantee that the request will be approved. So, you know, we do understand that sometimes things happen, but please know, even when you do that, it does not guarantee that the request will be approved. So examples of things that you could put in the comments are a JIRA ticket had to be submitted to address a BEAD's portal systems issue, which was preventing timely submission. You can also say the STBR is a resubmission due to an STBR denial appeal. You could say the provider or case manager did not respond to the RFI in the timely manner, or that because there are 2 pending STBRs, it's preventing the timely submission. So please, you know, make sure that you are putting in that comment section the reason for the untimely submission and that you're being as clear as possible, which will help our reviewers to make an appropriate decision. So if an STBR is submitted to the BEAD central office after 45 days and a reason is not provided in the comments section, this is not a reason for an RFI, and the STBR will be denied. So we will not go back and ask why. It is the responsibility of the person submitting to put that in the comments. Also wanted to talk about RFIs just a little bit. So RFIs allow us to kind of ask for more information, but really for the most part, they shouldn't be necessary. So it does, you know, when there are a number of RFIs, it clogs the portal and prevents timely review action on those STBRs and LTBRs. So please keep in mind that if questions are responded to thoroughly and the supplemental documentation is present and complete, that really should provide sufficient information to support the budget request. And then those can be processed much more timely. So case managers and providers are responsible for reviewing the portal on a regular basis to ensure those RFIs are responded to in a timely manner. So please make sure that you are watching that. So if you do receive an RFI, you can respond to that quickly. And the case manager and case manager supervisor must ensure that all information is accurate, relevant, and supported by the documentation prior to the submission to the BEAD Central Office. So it is our practice that we will only RFI 2 times. So if the individual or if the information is not provided or clarified after that second RFI, then the request is denied. And so again, with all of those denials, appeal rights are included within the notification in the letters. Also wanted to talk about waiver services and modifications. And so requests for more than one-on-one staffing is a modification as outlined by the home and community-based settings rule. And you can refer to the trainings that we have done a number of trainings around restrictions and modifications. So keep in mind that any request for more than one-on-one staffing is considered a restriction or modification. So therefore, additional questions must be answered prior to submitting the short-term budget request or the long-term budget request to the BEAD Central Office. I'm going to kind of go over some of those questions on the next slide. And they're not currently in the portal, but will be added in a future update. So just please keep in mind that these questions should thoroughly be addressed within the submission. So when submitting for greater than one-on-one staffing, you should be looking at what is answering what is the specific and individualized need. Has the team reviewed the PCISP services to determine where the increase is needed? What services will be increased? How many units or hours per month are being requested? Can the provider staff the requested units and hours? So that is an important piece to ensure that if the person requires 2-on-1 staffing, that the provider is able to provide that. And if the individual requires 2-to-1 staffing during sleeping hours, there must be a detailed explanation as to why that is necessary. And then also you should thoroughly describe the conditions and/or issues that are directly proportionate to the specific assessed need. Describe the positive supports or interventions used prior to any modifications. Describe less intrusive methods of meeting of the individual's needs that were tried but did not work. Give detailed established timeframes in which the IST will review the modification to ensure it is still necessary or if it can cease. And how is the need for the modification being determined? That will need to be described in detail. Also, please include any data that is being reviewed and what that data is and how often to determine the effectiveness of the modification. Include if there is informed consent of the individual, and if that individual has a legal guardian, is his or her informed consent included? And if not, please explain. And please keep in mind that an individual who does not communicate with words still communicates. So you may not say, well, because they are not verbal, they're not able to give consent. You need to explain how that was obtained. And then include assurance that the interventions and supports will not cause any harm to the individual, and also include documentation of HRC authorization. Some additional information. So a provider emailing the CM requesting a budget request is not the end of the process. So a team meeting must occur within 45 days of the status change, and this must be properly documented via the case notes as described before. For the short-term budget requests, if an individual has a remaining allocation and the allocation can cover the full cost of the STBR, then the STBR is unnecessary. So the case manager should do a PCISP update. And again, this is where being proactive becomes very important. So the short-term budget request response should not be copied and pasted from one STBR to another. Also, the STBR responses should not be the same for every question. Authorized providers on the PCISP can view the status of the STBRs and LTBRs in the BEADS portal, so please make sure you are checking those. And BEADS is not responsible for ensuring that the hours and units are correctly calculated in the request. So if it's not clear in the submission, we will return that with an RFI to get more information, but please keep in mind that delays the review. So the information should be clearly displayed, and the STBR request should take into consideration alone time if the individual works, PA hours, and other services like day habilitation to equal the amount of hours in the month. And also want to look at, has the IST reviewed the PCISP services to determine if there are unused services where the funds can be utilized for the requested service. So just a couple more slides around this. So please keep in mind, I think we actually already just said that. So I apologize, that's a duplicate slide. So for all STBRs and LTBRs, it's important to remember that Medicaid is the payer of last resort. So in any and all situations, not just STBRs and LTBRs, but individuals who are utilizing services, they should be also looking at natural supports, Medicaid PA hours, other services that may support their needs. What are some opportunities within competitive employment and volunteers? How many roommates or housemates do they have? Residential training or changes. All of this information when you are submitting an STBR, LTBR must be included with the request. In addition to kind of thinking through all of those other supports and services that may be available, please include any relevant documentation. So, such as if you have applied for Medicaid PA hours and been denied. So keep in mind that STBRs are short-term budget requests, so they're not intended to continue indefinitely. If the individualized support team cannot provide support that is actively trying to reduce or minimize the use of STBRs, subsequent requests after 6 months may be denied. So a previously approved long-term budget request does not mean that subsequent long-term budget requests will be approved. So with denials for the STBR and the appeals, so if a provider appeals the STBR, please make sure the following information is included in that appeal. So the notice to appeal, so an actual letter that states your intent to appeal, the STBR denial letter, and any relevant documentation. So if a provider appeals when an STBR was not submitted or it is auto-closed due to inaction, the provider must indicate or must include the service authorization notice of action with their notice to appeal and with their documentation. So then looking at required long-term budget requests. So please complete prior to a long-term budget request submission in the portal, regardless if this is a case manager or provider initiated LTBR. So case managers should always double check that all information is included, correct, and complete before it is submitted. So please include the team meeting, that once an LTBR need is identified, a team meeting must occur within a timely manner. So that's ideally within a week of the identified need. And then just as for short-term budget requests, the need for comprehensive case notes is necessary, and at a minimum, the following must be documented. So again, the date of the team meeting, who's in attendance, the individual or legal guardian consent, and if any IST member has disagreed with the request. So the case manager obtaining consent from the individual or legal guardian, again, is not counted as a team meeting. That is not a team meeting, just to obtain consent. So similar to the short-term budget requests, there is some additional information in the BEADS portal under the resources, and you can review that in the BP2 user guide for more information. So please keep in mind that all included documents must be current, signed, and dated appropriately and include the entire document. Again, as we've said before, if it's not documented, it did not happen. So please make sure that that document exists and is clear and current. And again, just as with short-term budget requests, with long-term budget requests, if the individual or legal guardian does not agree with the request, it will be denied. So I know that was a lot of information around STBRs and LTBRs, and we really hope that was helpful as we are, or as you are supporting individuals in our services to ensure that they have the appropriate budget to meet their needs, and that you as providers are able to support them appropriately. So as I said in the beginning, you know, we really want to ensure that this webinar is beneficial to everyone. And so we know that as we have moved from just having the CIH and FSW to now having the health and wellness and TBI waivers, you know, there's information that's specific to each of those types of waivers and information that's specific to everyone. And so we are really working to try to make these webinars beneficial for everyone and meaningful for everyone. So please feel free to give us your feedback and any kind of webinar topic ideas that you may have for the future. So we will continue to do these monthly. They are scheduled through the end of December for monthly, and as we start those in the new year, there will be a new cadence with links and an announcement sent out. So I think we are right at time. Therefore, I don't know that we have time to get to any of the questions, but please, if you have questions that you need to get addressed, you may reach out to the BEADS help. It's the bds.help@fssa.in.gov, and they will ensure that your questions get routed and answered appropriately. So thank you all so much for spending your lunch hour with us, and we look forward to seeing you next time.